brief background on our organization. It's much like an American Legion, but for Ukrainian American veterans. We have a long and proud history, starting with the Revolutionary War till present. Amongst our ranks, we've had 5 Medal of Honors, Assistant Commandants of the Marine Corps, Commandants of the Marine Corps, Generals, General Crouch, who's helped with Ukraine engagement from the outset. So we have a proud but not widely known history because we haven't started shaking our sticks. So now this war has been an inflection point for our organization, and if not us, then who is going to support veteran NATO interoperability and Ukrainian veteran support. As such, we've taken a solid look at the situation in Ukraine, not relying on anybody telling us something, but rather sending our own people to see. This is a post-Soviet country. All the problems are the same. Mirroring ineffective mechanisms is not helpful. So we've dug through all that, and we bring our own experts. We have with us Dr. Maloka. There's Dr. Samatoka, who's an ER surgeon, also very skilled, interacted with Ukraine for many years. I asked if you guys talk to them if you have questions. We also anticipate opening a post in Kyiv very soon. We have Roman Marshovitz, our former Ukrainian Special Operations Forces, Navy SEAL, and we're trying to partner with all of our diaspora groups to develop effective coordination. So I'm going to pass it over to Dr.
Thank you. So my name is Darren Maloka. I'm a clinical psychologist currently working in private practice in Rhode Island. I was trained at the Boston VA, and I worked for some time at the National Center for PTSD in PTSD research in Boston. I was part of a Canadian volunteer mission to Ukraine, to a veterans hospital outside of Rivne, Ukraine in October of 2019. This multidisciplinary mission included various professionals training their counterparts on a rehabilitation unit for military combat neurotrauma victims. Most recently, I was contracted to consult in Western Ukraine for a man who sustained serious physical and psychological injuries on a work site in Western Europe. He was admitted to the type of facility which is also part of the treatment options for disabled veterans in Ukraine. Given the lack of appropriate resources, expert Westerners were flown in to provide treatment to the patient and in order to aid with the training of local providers. Just this past weekend, while in Kyiv, I met with the former Ukrainian Minister of Health, Udana Suprun, who informed me of her continuing efforts with NGOs to improve public health overall and mental health in particular in Ukraine, which may prove to be somewhat more difficult given recent changes in the Ukrainian government. I had an opportunity to meet with the founder of Lifeline Ukraine, a recently launched national suicide prevention hotline for veterans. I also met with Vsevolod Stebluk, a former military physician and current professor at the Ukrainian Institute of Military Medicine, and his wife, a military psychologist, who are engaged in research and clinical work regarding the treatment of Ukrainian veterans of the current conflict, particularly female veterans. My general observations included, Ukraine has no analog to the VA healthcare system. There's no central registry of veterans, although apparently work on this is underway. The development of a multidisciplinary approach to treatment is still in its infancy. Professionals often work in silos and occasionally at cross purposes. Familiarity with general medical care exceeds that of neurological and other specialized care. The most critical need is in mental health care, particularly PTSD, often complicated by neurological, physical, or other psychological comorbidity. Professional licensing in the country is non-existent for psychology. Individuals with the bachelor's level or occasionally a master's level training comprised most of those who conduct psychotherapy in the country and are referred to often as psychologists. Now, there are many well-intentioned healthcare providers in Ukraine, but they lack the resources, multidisciplinary support, and training in evidence-based approaches to the diagnosis and treatment of PTSD and comorbid conditions that are prevalent among veteran populations. When such mental health providers do in fact go out of their way to receive additional training, it's often from people from European countries that tend to employ either outdated or non-validated approaches to mental health treatment, including old approaches such as psychoanalysis and other non-validated approaches such as NLP or various other not empirically supported treatments. So improving training for the treatment for PTSD diagnosis and treatment would address a major unmet need in the country. There's a general lack of information in the Ukrainian language and or that is technically understandable for those without an extensive foundation in behavioral health care, which many do not currently have. So in conclusion, there's clearly a tremendous need for veteran services, particularly in the area of mental health, that's not currently being met and requires a systemic change. As we engage in possible assistance from U.S. government entities, we should be mindful that in order to maximize effectiveness and to get value for our investments, we must engage in efforts that are not only useful in the short term, but sustainable in the long term. Thank you for your attention.
We appreciate your work on behalf of the Ukrainian American veterans and obviously your ties with Ukraine. Next, I would like to introduce Christy Ann Hoffland, Senior Program Officer at IREX. Please, Christy.
Thank you very much, Michael. Thank you to the organizers, and thank you to everyone here for your interest and for your support of veterans in Ukraine. It's a privilege for me to be here today to share some of the work that my colleagues and I at IREX are doing to support veterans. IREX is a global development and education organization. We have 400 staff worldwide, and we work with partners in more than 120 countries in 4 areas essential to progress: cultivating leaders, empowering youth, strengthening institutions, and increasing access to quality education and information. Our 2-part veteran reintegration program in Ukraine is designed to fill critical gaps in data and information on veterans and incorporate this data into tailored activities to improve the quality of and access to veteran services and to promote veteran integration into the workforce. Our activities center around 3 areas: expanding employment opportunities, increasing access to mental health services, and supporting the Ministry of Veterans Affairs by creating and rolling out the digital registry that was mentioned by the last speaker. We work hand in hand with local partners and with the support of the U.S. Department of State. So our project was launched this fall, and currently we're active in the research phase. The goal of our research is to increase the knowledge and understanding of veterans of the war in eastern Ukraine, their needs, the challenges they face, and how communities and local organizations are able to meet those needs. Our research will ground the design of our Phase 2 activities in a contextualized understanding of veterans' issues. We started this fall in November with 12 focus groups in the cities of Dnipro, Lviv, and Kiev. And today I'd like to share with you some of the preliminary findings of our focus groups, which explore the areas of social, economic, and health needs. In the area of social needs, the focus groups revealed that social marginalization is a significant impediment to reintegration in the workplace, in public, and even at home. The veterans told stories about how they were marginalized in all 3 areas of these domains. They were faced with assumptions that they're aggressive, dangerous, or that they're faking their veteran status in order to get benefits. In each case, experiences involved shame, sometimes public, sometimes private, in ways that created a barrier between civilian life and the veteran experience. For example, one veteran was given a psychological evaluation for a job only after it was revealed that he was a veteran. Someone was shamed in public transportation when they tried to use transit benefits. Drivers and other onlookers said that you are a fake veteran. Others said that their social circles had shrunk after their service. They were faced with negative biases towards veterans. Some of them even faced these biases in their families. Spouses or parents sometimes failed to understand why their family member would have left, creating a tension in the household. On the other hand, some families were also a source of resiliency for veterans. Some vets expressed strengthened relationships with their spouses upon returning to civilian life. In the area of economic needs, the most common sentiments among veterans that we talked to were dissatisfaction and irritation at the malfunctioning of the existing benefit system, especially at the local level. Some of the greatest anger and frustration was related to housing assistance. One vet, for example, said that they waited years to get on a preferential list for housing, and it still hasn't happened. Employment is also a major concern. Vets often do not return to the same work after their military service. And the reasons they gave ranged from medical problems that prevented them from doing that, or to reevaluating their values and deciding to do something different. In many cases, employment assistance, including development of professional skills, was highly desired, but knowledge of such opportunities was low. In the area of health needs, physical issues, the most common concerns across groups were sleep difficulties and fears of addiction. Many felt that they had to figure out how to fund their medical treatment for themselves. The compensation they received was far too low for the needs that they had. We heard stories about being diagnosed with conditions needing treatment, followed by an inability to fund that prescribed treatment. There was also discontent with rehab centers. One vet was referred to by a specific medical center only to find they had no medicine, no food, and no supplies. One vet was told that there was no free treatment or medicine for combat veterans and told to buy whatever they needed at the pharmacy themselves. Access to good psychological health care varied. There was skepticism of psychological services. Many veterans said they were worried about being perceived as insane or dangerous if they sought this kind of help. Some claimed that they did not need psychological support, and others claimed that they wished they could get help, but they just didn't know how to find it. Vets reported a lack of professionalism in psychological services received, and they were also made to feel as though they were burdened by the practitioner. In multiple cases, vets expressed that they felt that the psychologist, quote, is simply not interested in me, and that they rush through services and quickly provide a prescription for a sedative as a cure-all. We also, in our focus groups, talked to non-veterans to try to gauge the attitudes of non-veterans. The views of veterans held by non-veterans are mixed. While generally people say that veterans are courageous and patriotic and express gratitude for their service, they also express concern about the mental state of veterans. Furthermore, some respondents differentiate between volunteer veterans, who are perceived more positively, and salaried contract veterans, who are seen more negatively because there's a concern that they're driven solely by profit. So now we've finished the focus group stage of our research, and we're moving into a survey portion, and we've started that in actually March 2, so we're just in the beginning of it. And in the survey portion of our research, we are surveying both veterans and non-veterans, about 2,000 in each group, and we're trying to investigate in greater detail the nature, the scale, and the scope of the problems and resiliencies that we discovered during the focus groups. Although we just started, what's been interesting so far in that research is that the veterans are very willing to respond and share their stories. The recruiters are telling us that veterans are willing to travel, even to other towns, just to engage in the interviews. So we plan to finish data collection by the end of April, and we look forward to sharing with you all the results of our findings and how it will inform future activities that support veterans. Thank you.
You know, my mother taught me well never to leave a woman to say the last word. And I am not, because we do have another special guest as well. It is an honor and a privilege to introduce to you Mr. Henry Huntley, who is the Senior Advisor to the Executive Director at the U.S. Department of Veterans Affairs. We'll have a few words to say about the international programs that the VA has, in particular with Ukraine. Mr. Huntley, you can there, here, wherever is best for you.
Thank you very much.
Thank you for being with us.
Well, again, I'm Henry Huntley, and I'm from the Department of Veteran Affairs, and I'd like to, again, all right, which one is working? Stereo. Okay.
Take both.
We'll do stereo. Again, I'm Henry Huntley from the Department of Veteran Affairs, and I'd like to thank everyone here for allowing us to be here. I don't have very much to say, but what I'd like to do is I just kind of highlight that for the last 3 years that I've been a part of Veteran Affairs, the Ukraine relationship has been very, very great with regards to how we interact with each other. We've had multiple visits to the Department of Veteran Affairs to talk about what we do here in the U.S. with regards to our veterans and some of the challenges, but also what we do to try to bring their lives back to normalcy. Resiliency is a big word for us. And again, as I said, to try to bring their lives back to normalcy. So we have 20 million veterans here in the United States. And out of those 20 million veterans, there's only about 9 million veterans that we actually have track of, and or keep track of. And out of those 9 million, there are about 8 to 4 million veterans that are seeking some type of services from VA. So there's a wide range of numbers there that we have to consider. So one of the things that we're trying to do as an organization that's on behalf of our veterans is find those veterans that are in those disparate locations around the country, around the world, so that if they do need our services, we can provide a little bit of help to them. So having said that, like Ukraine, many of our challenges are the same with our veterans. Once a veteran comes back from wherever we send them around the world, many in harm's way, there are challenges, and many of those challenges are unseen. But it's our responsibility through the administrations that we have as a part of VA, whether it be Veterans Health or Veterans Benefit, or our Veteran Memorial Affairs, where, of course, unfortunately, when our veterans die, we have someone to take care of not only that veteran, but their family, so that they will never be forgotten. And that's a very, very key thing for us, is ensuring that our veterans are never forgotten. VA has a large mission. We have veterans all over the place, and we have facilities all over the country and other places. And sometimes there are challenges with reaching out to those veterans. And I'm sure many in the room who have been here in the country or read over the internet, you've seen that sometimes we have challenges because we have so many. But I will stand here and I will tell you that there's not better services anywhere, I believe, that you can find for our veterans, more so than Veteran Affairs. With our facilities, whether it be telemedicine, whether it be in-care facilities and services, or whether it be us having to provide veteran homes for our veterans. It is a challenge, but we also make sure that we have the right amount of folks to be able to go out to bed. So that's one of the things that I wanted to be able to mention to you. As the words of President Lincoln is to care for those who have borne the responsibility for battle. That is something that we take to heart. We must do that, because as we look at our veterans and how we care for them, it's not only a responsibility that is inherent to us, but we look at it as a matter of national security. Because as someone spoke to recruiters a little bit earlier on, if we don't take care of our veterans for what they have done and provide for their families, well, guess what? My uncles, my sisters, my brothers, my mother, or whomever in my family is not going to allow one of my family members to join our forces. So we have that great responsibility of ensuring that if someone gets hurt, that we provide for them. If someone passes in action, we have a responsibility to take care of that person and their family if needed. So those are some of the challenges that we have, but that's what we try to do, and I think we do that quite well. The relationship that we have with Ukraine, I'm sure that it's going to get bigger and bigger as we move forward in this century and hopefully beyond. There's so much that we are all doing that's the same, but there's so much that we can continue to share, whether it be with technology on the battlefields or technology at our veterans health centers, or whether how we provide benefits to our veterans. Those are the things that I think are most important, but nothing more important than the relationships that we have. So I know I've spoken a little bit too long, but it's an honor to be here, and I'm also honored to know that I'll be seeing many of our teammates here a little bit further in the future. So thank you very much.
Mr. Humphrey, it's truly an honor to have you with us today. We obviously are extremely thankful for all the services that our VA provides for our American veterans, and obviously in terms of the relationship and the building of capacities with Ukraine and other countries throughout the world. I think for Ukraine, it would be an opportune and idealistic approach on how the Americans, how we as Americans treat our veterans, social services that we provide, and for the Ukrainians to do the same. So thank you very much for joining us today. It is the bewitching hour. It is 2 before 1 o'clock, and we have this room until 1 o'clock, but we can continue in terms of informal discussion with all the panelists and the presenters during the reception, which is right outside in the corridor. I would like to thank, on behalf of all of the organizers, as you see they're listed here, and the sponsors, I would like to thank everyone for their participation today. I know that it was a hassle for some people to travel such long distances, but obviously it's well worth it. It's well worth it in terms of the opportunity to hear the plight of the Ukrainian veteran, to hear what's happening in Ukraine in terms of the current situation of Russia's war of aggression against Ukraine, and obviously to continue in the fight for garnering Ukraine as much assistance as possible. We have many challenges ahead of us. The challenges are here in Congress as well, and how best to integrate a program for Ukraine on how to inform for the plight of its Ukrainian veterans, how best as well to provide and garner continued military assistance for Ukraine. We are most grateful for everything that the United States Congress and administrations have done since 2014 to help Ukraine in this fight against Russian aggression. This is not an easy fight, obviously, nor is this just a kinetic fight. This is a hybrid warfare that is happening right now in Ukraine, and we must understand that there are aspects of cyber security involved here. There are aspects of disinformation involved here. There are many aspects of warfare which we don't necessarily consider to be warfare. But obviously what is going on right now in Ukraine, if anything, is the proving ground of this Russian hybrid warfare for the rest of the world. We're most grateful for those American soldiers that have trained the trainers in Ukraine, that go to the Yavoriv, base in western Ukraine and train those Ukrainians that either come back from the front lines or will go to the front lines. And it's most interesting that it's not the Americans that are training the Ukrainians, but the Ukrainians also, the Americans also receive information from the Ukrainians on how this hybrid warfare is actually being implemented firsthand on the ground in eastern Ukraine and obviously in Crimea. So I leave you with a parting thought from several very renowned individuals in American history. The first being Ronald Reagan. Ronald Reagan, who spoke at a Veterans Affairs event during his presidency, uttered the following, and I quote, "Freedom is never more than one generation away from extinction. It must be fought for, protected, and handed over to them to do the same." Those words, I think we can be grateful for the Ukrainians who have stepped up, gone to the front lines, have come back, have informed Ukraine society about what is happening so that everyone is protected against the Russian aggressor. And lastly, General George Patton, a military figure within American history, who had mentioned in terms of veterans, and I quote, "It is foolish and wrong to mourn the men who died. Rather, we should thank God that such men, and add to that end women, lived." We are honored, we are grateful that 2 Ukrainian veterans are with us today. We are honored and grateful to those American veterans that are here in the audience with us. I ask you not to forget about Ukraine. I ask you to contact your members of Congress on a regular basis, inform them of the situation in Ukraine, ask them for their assistance in greater foreign assistance to Ukraine, whether it is military assistance or other types of programs that are beneficial for the strategic partnership which now exists between Ukraine and the United States. Ukraine is a frontline state of Russian aggression, not just for Europe, but for the entire world. I thank you all for your participation. I'd also like to thank our interpreter at large today, Taras Moskalenko, for doing an excellent job. And I bid everybody adieu and ask you to join us for a reception. However, please, I would be remiss if I did not say this, please be mindful of the current situation here in the United States. There is hand sanitizer available out there. Please do the elbow bump, please do the jazz hands, but please be mindful of the current situation here. Thank you, and look forward to your future attendance at other events. Thank you.